Okay, we are going to look for the occiput and the nuchal lines. First, we're going to take the fingers and bring them right below the skull. I'm going to move up. I'm going to find this bony protrusion right here. And then that's the occiput right here. I'm going to move laterally, which is another protrusion sticking out. That's going to be the superior nuchal line. And when I move down, I should feel the inferior nuchal lines as well. All right, everything's kind of sticking out, so you can feel them pretty good. Okay, the cervical spinous processes. All right, so I'm going to place my fingers at the base of the skull and move downward, feeling each bump. Okay, I want you to stay neutral. Okay. So, okay, move your head back. Okay, forward. Okay, back. Okay, forward. Now, what I'm doing is I'm checking C6 to see if it disappears. And this is 6, so this should be 7 right here. This should be C7 and 6. Now I'm looking for the hyoid bone. So, as you can tell, our patient is female. So, this is my daughter. She's being a good patient so far. So, I'm just finding the cartilage. And just above the cartilage, I'm finding the hyoid bone, which is, so the cartilage is right here. The hyoid bone is just above the cartilage. I can shift it left to right. There it is. All right, the thoracic spinous processes. T1 is right underneath C7. So up. Okay, that's 6. Down. This is 7. Okay. So T1 is right here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. All right, rib angles. There's 1 through 12. So 1 through 3 is the upper ribs. It's 1 through 3 is right below the scapular border, which is 1, 2, 3. And then the mid ribs, which is 4 through 9, 4, 5, 6, 7, 8, 9. All right, and they are lateral to the spinous process. And then the lower ribs, which is 10 to 12, should be 3 of them. So there's 1, 2, and then 3 right there. Now, for the lower ribs, they are shorter, more oblique, and yeah, they taper out forward. Okay. The sternum. This is the jugular notch. This will be my landmark. This bony plate right here is the manubrium. As I go down, I feel what's called the angle of Lewis. That connects to the sternum. I'm going down the sternum, and I'm going to feel for the xiphoid, which is down here. Okay, we're going to be palpating the sternocleidomastoid. Go ahead and lift your head, turn to the left. All right, we're going to start from the ear. You can already see the muscle engaging. It connects all the way down to the sternum, the clavicle area. Go ahead and relax. Unilaterally, it rotates the head to the opposite side, laterally flexes the neck. On the right side, it rotates to the left and lateral flexion to the right. On the left side, it's the opposite. Bilaterally, it flexes the neck at the atlanto-occipital joint. The splenius, capitis, and cervicis. First thing we're going to do is we're going to find T1. 1, 2, 3, 4, 5, 6, 7. Okay, so this is T1. T1, and go ahead and lift your head. Look to the left. We're going to find the mastoid process. We're going to start from the mastoid process and the nuchal line, which is back here. We're going to follow it down. We're at T1. It goes all the way down to T3. 1, 2, 3. And then the splenius cervicis runs down to T3 to T6. So that's 3, 4, 5, 6, all the way down here. These, go ahead and relax. These muscles are deep to the trapezius. Unilaterally, they rotate and lateral flexion of the head and neck at the same side. Bilateral, they extend the head and neck. Erector spinae, spinalis, longissimus, and iliocostalis. Okay. Go ahead and lift your chest and head up. Okay. This will be, we'll palpate the spinalis. It's the most medial, which attaches to the spinous process. Right here. Longissimus goes outside, a little bit outside of that, lateral. All right, middle column attaches the transverse process. And then the iliocostalis. Go ahead, rest. Okay. Go ahead and lift again. Chest. All right. The action of these muscles extend the vertebral column and head, and they laterally flex the spine. Quadratus lumborum. Superior of iliac crest. Iliac crest, we find iliac crest here. And inferior of the ribs. And lateral of the lumbar spine, which is right here. Unilaterally, there's lateral flexion of the trunk, elevation of the pelvis. Bilateral, it stabilizes pelvis lumbar spine and assists in extensions. Now we're going to palpate the rectus abdominis. We're going to find the xiphoid process, which is right underneath, it's inferior of the sternum. Here, go and do a crunch. Okay, feel the six-pack. Midline of the abdomen. Go and relax. Action flexes the trunk, stabilizes the pelvis, and compresses abdominal contents. We're going to palpate the external oblique. Go and do a crunch. Rotate. Now flex to the right. Here you go. So down here, right underneath the ribs, immediately towards the linea alba and the iliac crest. Unilaterally, it rotates the trunk to the opposite side. Go and relax. Bilaterally, it flexes the trunk and compresses the abdomen. We're going to palpate the internal oblique. Go ahead and crunch. Rotate. Side bend. Okay. The oblique is lateral of the rectus abdominis. Lumbar flexion and pelvic rotation. And they also rotate the trunk. Lateral flexion to the same side. And lateral pelvic rotation to the opposite side.